Massachusetts this week is distributing something on the order of 200,000 at-home test kits to school children across the state. Do you not have a number of test kits, at-home test kits to distribute? I mean, can you replicate something like that? And to test this weekend, they're going to hand them out in Massachusetts before they go back to school on Monday.
Yeah, so I think I would probably have to go to Tom or to Mark on that one in terms of the availability of our, rapid testing and the test kits. Certainly in the plan. I don't know whether we have any currently that being distributed or not. Tom, what do you got?
Yeah, thanks, Governor. So as we shared last week, we're going to be looking to push about 1 million at-home test kits out each month to Rhode Islanders for the next several months. We have already pushed every at-home test kit that we have on a shelf here in Rhode Island out. So we're competing, nationally to bring some additional ones in. But I think what's important too is, especially when we have limited resources, there's a number of different ways that we can ensure that we're safe. So as the Governor shared, and as Victor I think can share some more detail on, we've had a robust testing program in our school, in our LEAs for well over a year. So many of them have a plan in place to test students appropriately before they return. We also have always prioritized our pre-kindergarten through 12 testing lines. So at our state sites, even though the availability is limited, those appointments are set aside, and we still have some appointments that are available. What's important though is using the testing appropriately. If you find yourself in a high-risk setting, if you have symptoms, those are the folks that we want to get tested. We no longer have that luxury now to use that as just a quick check to make sure if you're asymptomatic. We want to continue to expand so that we can get back to that, because a key part of this is enabling that we continue to do the things that we love safely. But with regards to schools, we just have a bit of a different approach here in Rhode Island.
Governor, we've heard from some doctors who are frustrated by the pace and urgency of your administration's response to what they consider the collapse of the state's healthcare system, both related to COVID and the staffing shortages. What's your response to that criticism, and do you agree that the system is collapsing?
So I certainly disagree with individuals who think that somehow that there's an easy answer to this and that there's an easy response to that. Like I said before in my comments, I don't think they're really paying attention to the work that we're doing. So yesterday alone, we had, again, I'll describe, we had leaders from all the hospitals in the state of Rhode Island. We had our congressional officers on the call. We had Department of Health. We had, our office as well as. So we're pursuing the options that can make sense, and we're going to continue to do that in a way that, and we're going to directly work with, and we have actually had the Physicians Association represented on that call as well. I'll go back to what I said in terms of some of the staffing issues. It was described that about 1/3 of the financial issues that they're having is because of the traveling nurse structure in terms of the pay. Just before we came here, one of the people who were on the call who were representing doctors was offered a $50,000 bonus to move out of state. So this is a federal issue that we need to address. So anybody who, I'm going right to the White House. We did a letter today to the White House, and we talked to the White House yesterday, and like I said earlier, we talked to Secretary Marty Waltz. We're going to be on with another secretary nationally. So, yes, the individuals, I get their frustration, I get their concern. We're hearing that there's a great deal of stress at Rhode Island Hospital because of the structure of that hospital and the procedures that they provide. But right now, it's not easy, and it's a challenge. But the word that we're getting is that they are definitely meeting that challenge up to this point, and we're going to continue to talk to them in ways that we can help and assist them.
Governor, are there any plans to reopen the drive-through testing sites? We've been seeing lines around blocks, people waiting in the rain and the cold, considering.
Yeah, I'll let Mark handle that one. I think there is a drive-in that's setting up, right, Mark? Or Tom?
Yes.
Yeah.
Yes.
Yeah.
The answer, yes. So we're going to expand, as the governor said, all testing sites all throughout the state. As Dr. Nicole Alexander Scott articulated, vaccine throughout the state if we can at those sites. So yes, there's an initiative in play to expand those sites.
Respectful, sorry, Katie. I'm sorry, I skipped you. Go ahead, Katie. Governor, how quickly are you able to ramp up? You're saying Dunkin' Donuts Center January 10th or 11th? That's 10 days in the future. What is happening right now today for folks who are trying to get tested or who are ill?
Yeah, so I think that again, we're doing well over 20,000 tests a day. I think that we need to make sure that build the expectation of, coming from about 10,000 a day to 20,000 a day. We expect that progress is going to be made each and every single day. I think that the explanation at the convention center, the guard is being called back in, and they want to make sure that they've got it right so they can proceed properly. I think that you're going to see communities like East Providence that are already doing, vaccinations. Talking to the mayor there, they're going to be opening up testing sites as well, and we expect that that's going to resonate around the state of Rhode Island in a collective way. That's why we're here today, right? We're here today to recognize municipal leaders that are stepping up in a way that we need to make sure that happens. We're going to accelerate it based on the need, and I would expect that we're going to be making progress, immediate progress. But that's not to say that we haven't stubbed the toe here a little bit on the testing, right? That clearly has happened. We recognize that, and we're making the immediate adjustments that need to be made. And based on what I reinforce what Dr. Alexander Scott says, look, we've led the country in testing. We continue to do that right now. We're going to work our way through this as quickly as we can.
Why not ramp up earlier December before folks got together for Christmas? Are the tests not available? Are the labs not available? Why not do it sooner?
Yeah, well, I think that we always can look in the rearview mirror on things, and perhaps if you had a crystal ball, you could have done that. But remember, we didn't until coming up to Thanksgiving. This issue was not on the table. Infection rates increased, on December 4th, and then did it again on December 11th weekend and on December 18th. And we've been working on this for a couple weeks. And again, we're doing, I think, what do we do? How many tests did we do yesterday? 20,000? 25,000 tests were done yesterday. So the work is being done, the testing is being done, and we need to get better at it. But the fact of the matter is that we still lead the country relative to testing. We're not going to lose that space, and we're going to do the work that we need to do. And again, I think that what I said before, that's why our EMA director, Director Pappas, I've reassigned him to special duty here, and he's going to be working right out of our office right in the State House.
Bringing Director Papa into your office because you don't have no confidence in Dr. Nicole Alexander. It's not a good relation. Because before with Gina Raimundo, it was a better communication. Now we ask questions and we had to wait a month for an answer. And then after that, you reply to that, let Vito Capellan speak to for the Providence School Department.
Yeah, we can do that, but I'll push back on that. The role that we have is different in all our respective positions. We're meant to share information in a way that makes sense, and our outcomes are we're still leading the country in testing right now and we're leading in vaccination. We are still holding our own in terms of infection rates in the country. We're still holding our own in terms of death rates. We want to be the best. So good is not good enough. All right, so we're going to keep on working on that. But I think I don't think that's an accurate depiction in terms of the outcomes that we're getting. We are working together. We're on calls every single day, and we're going to continue to do that. Victor, you want to come up and fill in a little bit on the education issues?
Yeah. Thank you, Governor. So we wanted to take an opportunity also to just say thank you to all of our school leaders and all of our school teachers and staff, to all of the families and students, certainly for the work that they've been doing together. We appreciate the work that we are doing in partnership with the Governor's Office and the Department of Health to make sure that our schools are ready to come back to school next week. We have been working hard, as you heard, to expand testing. We have a number of initiatives that we're working on. Later on today, we will be releasing additional guidance to our school districts, and we'll be working directly with our superintendents and school leaders to make sure that they have the supports that they need. We know that one of the places that is doing a staggered start is in Providence, and so Providence will be doing a different start. Each community is going to be adapting to their local context, and we're working with them individually to support each community to make sure that they are doing what they need in their communities. The one invitation that we do have specifically for Providence families, as the Governor mentioned, we have a testing clinic for Providence students and their families this coming Sunday, January 2nd, from 9 to 12 at PCTA. And so we're really encouraging as many families to bring their students to be tested. And, you know, we have heard from parents across the state that they want their children in school. We're taking action. We think that these new guidance from the CDC and the work with the Department of Health will make life easier for our students, our families, and educators alike. And while we're protecting their health and safety, we're looking forward to working with our leaders to have our students in school. Thank you.
Yeah, hi, I'm just wondering if you can speak to when we can expect the response rate for tests to get back to that 48-hour window, because folks are waiting quite a long time right now.
Yeah, so with regards to the PCR turnaround time, so we onboarded a lab, they started receiving samples, and we had to go pretty far from Rhode Island inside the region to find one available, but we've doubled our lab capacity. So what that means is our PCR turnaround times are starting to come down this week, and we're confident that by next week, our PCR turnaround times will be back about the levels that Rhode Islanders are used to. Again, we prioritize them. We have 120 long-term care, congregate care facilities that are in that enhanced outbreak response protocol, and those are first in line, keeping people alive and keeping them out of the hospital. Those are staying between 1 and 2 days. Our schools are about 2 to 3 days, and our general population, general public is about 3 to 5, but those are coming down. But the goal is to get them all down below 2. With that, we need to continue to expand. It's already twice as big, our lab capacity, as it's ever been. We're expanding to additional labs, and we're purchasing through our partners here, are purchasing additional equipment to get that capacity back in state in Rhode Island.
Where's the lab? Dr. Scott?
Where's the lab? New Jersey.
Dr. Scott? Question. Jackson Healthcare is a significant facility, healthcare system in the Miami, Florida area with roughly a capacity of about five of our largest hospitals combined. They took the provocative step of acknowledging that 57% of current COVID-19 hospitalizations, in fact, are incidental, where COVID is present but was not the precipitating factor in hospitalizations. Will organizations like Care New England, Miriam, Rhode Island Hospital be disclosing that type of information?
They will continue to relay the data that we are currently displaying in terms of hospitalizations overall. What we have up on our website now works well. We've done an analysis of the data and understand that, and are going to continue to relay it in a way that is helpful for Rhode Islanders. Right now, it's close to 90%, and so that's something that we'll continue to follow.
All right, last question, Michael. Pat, we just got to get to Michael.
Okay.
And that's the last question.
Thank you. Governor, I'm concerned that, you know, you said that if we had a crystal ball, we could look back and make certain decisions and do things differently, but that we didn't see the increase in case rate until Thanksgiving. But I respectfully would not characterize the data that way. It looks to me that we've been seeing a significant increase just on, you know, the state's own data from 7-day caseload or 7-day interval caseload dating back to about the middle to the end of October. And I specifically remember asking that question at a press conference at around that point. And that's about the time when we started seeing caseloads effectively doubling in that 7-day window.
I don't think that's correct.
Well, I'm looking at the data in front of me.
Certainly followed that data. We were in a ramp down strategy because we were getting you know, lower infection rates through the beginning of November. So look, you can look back if you want to look back. We're still in a spot where we feel comfortable that we're providing the health needs that we need, keeping the economy open, getting our kids in school in a way that is working on behalf of the people in the state of Rhode Island. So I'll look at those numbers again, you know, out of respect to the question, but I don't believe that's accurate in terms of early October. Actually, we were reversing that trend, not increasing that trend. I'll look back and certainly clarify that, and when we get back together again, if I'm wrong, then I'll certainly admit that. But the data that I've been looking at, you know, like I said, we were in a ramp-down strategy the week before Thanksgiving. We were clearly in that. But we've responded to the issues that are directly in front of us, and we have increased the capacity of the testing significantly. The area that is challenging right now is getting the results of the test. So, and then we're addressing that as well. But we've grown, what, 25,000 tests in a day yesterday? I mean, there's virtually no state, if there's any state in the country, that's doing that on a per capita basis.
That's certainly true, Governor. Rhode Island is 10 times better than some of the states on the lower end of testing. There's no question about that on a per capita basis. Rhode Island is the national leader. I guess what I'm really asking is, could we have possibly missed some early warning signs beginning in the middle of October?
I don't think they were there in the middle of October.